Our next and final speaker is Clare Wrobel, Director of Payment Reform Models for the Healthcare Transformation Task Force. They've been working with their members to improve care for high-cost patients, and I'll turn it over to her so we can learn more about their work and the future landscape for value-based payment.
So as Catherine mentioned, I'm going to wrap up this set of presentations by providing a bit of an industry perspective on the current policy environment and how that impacts value-based care delivery for the high-needs, high-cost population, and really, as we see it, the future of payment models that will support care management services for these populations and consumers. So a bit more about our group. Our mission is really to achieve results in value-based care. The Healthcare Transformation Task Force, it consists of patients, payers, providers, and purchasers that are all committed to moving into value-based payment arrangements and have made that a commitment to move 75% of their respective businesses into these arrangements by 2020. Our members represent both regional and national organizations that have been early adopters in value-based clinical care models, including Blue Cross Blue Shield of Michigan, which is represented on this panel as well, and have really been pushing, again, the movement towards value models and better incorporation of care management for the high-needs, high-cost population. One of our areas of focus has been on identifying successful models for improving care for high-cost patients, and to that end, we released a series of white papers that address the steps that organizations have taken. As the other presenters have noted today, there is a step of proactively identifying those patients, developing care management programs to specifically meet their unique needs, and utilizing supportive payment mechanisms to sustain those programs over time, with a highlight on multi-payer approaches to sustaining care management, as was highlighted in the Blue Cross Blue Shield of Michigan case study. Our next area of focus for this work will be in identifying successful mechanisms for integrating social services into those existing care management programs and addressing the social determinants of health. And to that end, we will be hosting a webinar next Tuesday, May 23rd, discussing a framework and highlighting a case study in that area. But what I want to talk about for the next couple minutes here is what we're paying attention to on the policy horizon. Obviously, the ability to provide high-quality care for this population is dependent on coverage and access to care. And I think if one word could describe the current landscape and environment in Washington, D.C. right now related to this, it's really uncertainty. And so what we're watching now is really all eyes on the Senate. The House will be ultimately sending that bill to the Senate of the ACA bill for review. While they're awaiting the CBO score at this time, the Senate has still started a working group to define what that would look like. We're seeing greater participation in that discussion from governors. Governors, and especially those Republican governors who have expanded Medicaid and that understand a bit more about how their Medicaid expansion programs have been working in their states, are pushing the Republicans in the Senate to consider greater flexibilities for states to continue to expand Medicaid for the population, and obviously one that is impacted greatly by the care management programs discussed today. That while the value agenda itself, when we think about value-based payment models to support transformed care delivery, while not directly addressed in the ACA and repeal and replace discussions to date, there's certainly several factors that will indirectly impact those efforts, and coverage being just one of them. And that coverage, while there has been recent analysis specifically from the Kaiser Family Foundation identifying that there would be direct impact on about 6.3 million people that have had a gap in coverage in 2015 that would put them at risk for higher premiums and potentially push them out of coverage. we're still trying to determine based on what the final bill will look like, exactly what that impact would be. But that, again, going back to that keyword, uncertainty, is having a lot of impact on how the private sector and provider organizations are finding an ability to make reasonable investments in the value-based care space. While I'll speak in a minute to the continued advancement through MACRA, which retains bipartisan support, another interesting policy development has been in the Chronic Care Act, which was reintroduced in the Senate and voted unanimously out of committee yesterday. This is a bill that would bolster care management for Medicare beneficiaries with chronic conditions. One of the provisions that was introduced included a beneficiary incentive program, which would encourage greater participation in preventive care, and a number of other provisions that would improve the accountable care organization model, the Medicare accountable care organization model, which again will impact care delivery programs for this population. So the opportunity to move the value agenda back up the priority list is really here at this time. The other big piece here that's moving Medicare and the rest of the delivery system into a more value-driven formula is really MACRA and the incentives to drive towards better coordination of care for high-needs Medicare beneficiaries through incentives to move into advanced alternative payment models. We've noted that the pick your pace for MIPS in 2017 could have a varying degree of provide varying degrees of motivation for providers to continue along their value-based transformation journey. There's also been about 2/3 of Medicare providers that have been exempt from MIPS. So what does that do in terms of continuing the momentum, encouraging and incentivizing providers to adopt new care management models? We're starting to see at CMS the leadership and HHS, the leadership team fill out, and some of those priorities, policy priorities, gain more shape. One of those is on focusing on reducing the provider burden through regulatory reform. As communicated by Secretary Price and Administrator Verma in public statements and recent requests for information, this is really a central theme from this administration. And again, we'll see how that plays out as it relates to the other policy items for discussion. We're also looking at how the new policymakers will utilize the Center for Medicare and Medicaid Innovation, which is invested in private sector and provider transformation and adoption of value-based payment models that support better care management and care delivery for this population. It has proved to be a valuable testing laboratory, and we believe that while there may be some pruning of the tree, that this has moved away from being a lightning rod and is really going to provide that laboratory for the Republican administration to test their agenda. Part of this has also been expressed as a desire to test more state-based innovation, Medicaid participation in several of these innovative payment models that have been mentioned today on the webinar, including the Comprehensive Primary Care Program, has been really critical to advancing multi-payer adoption of value-based payment models that encourage greater care coordination. These types of additional flexibilities built into the Medicaid program is something that we'll be looking for. Also, whether or not this administration makes a decision on encouraging mandatory versus voluntary bundled payment models. We know that Secretary Price has in the past not been supportive of mandatory models, and the new episode payment models, which were addressing cardiac and orthopedic episodes, were delayed. Yesterday, it was announced that they'll be delayed until January 1st of next year. And we do see a proposed rule pending OMB review that could modify the mandatory nature of those models. So we're basically looking at this to see what's the direction, what's the signal that we're getting from the administration on their support for continuing the investments in value-based payment models. So the other area that we think could be an interesting mechanism for bringing additional payment models to support care management programs would be through the PTAC, or the Physician-Focused Payment Model Technical Advisory Committee. This is a vehicle that was introduced by MACRA, which allows private stakeholders to bring physician-focused alternate payment models forward for consideration for CMS to take on and test. The PTAC reviewed its first proposals and made decision on its first proposals in April, recommending 2 of those models to move forward, and one of those specifically addressing chronic conditions that were associated with high costs. So this is really a vehicle that could, for the private sector, again, could bring promising models forward for testing at a greater scale within the Medicare program. And how CMS at this point proceeds on those recommendations is an open question, but something that we're watching closely. So just to wrap up, the current environment at this point really does affect the existing momentum, as I've mentioned. The prior presentations demonstrated that this is really hard work to set up these types of programs, and it takes time, investment from providers to implement, and especially these programs that are addressing the unique needs of a high-need, high-cost population. Medicare and Medicaid participation in these new payment models to support those programs has been critical to supporting that implementation and transforming the delivery system, and sustaining that investment is really now the question. And for new entrants to value-based payment models, it again is a question of whether or not they have the certainty in place to start. So what we're asking for, and as an industry group that is supportive of continuing this transformation, we're continuing to educate policymakers to promote that momentum, maintaining the rhythm from the private sector so that the public sector can stay engaged, and asking for additional signals from policymakers for support for value-based payments so the marketplace doesn't chill to ongoing innovation and improved care for high-needs, high-cost patients. And so with that, I'll turn it back and say thank you for listening, and to the other presenters for the terrific work they've been doing to improve care for this population.